3/4 of humanity live on coastlines or on the banks of rivers flowing into them. Not surprisingly, port cities are among the most bustling and creative human hubs in the world. They are engines of economic, social, and cultural growth, gateways for global trade and human migration, and an endless stream of exciting new ideas. Along with the oceans and seas' bounty come huge challenges. These challenges include air and water pollution, infectious disease, economic disparity, and poverty. As Earth warms and sea levels rise, port cities face the most daunting challenge of all. This is the first in a series of films about the world's great port cities. Today, we take you to Rotterdam, the largest seaport in Europe and one of the largest in the world. In this film, we address Rotterdam's colorful history, the often troubled and invariably complex interplay between city, people, and port, and how people are coming together to make the city economically, socially, culturally, and environmentally sustainable, to become the healthy port city of the future.
There is a motorway going up north. That's one of the most polluted areas in the Netherlands.
In the past, we looked at cars and trams and metro, cyclists, and then the pedestrians, and we flip that pyramid around. So we start with the pedestrians, then the cyclists, the public transport, and the cars.
So you can see all these NO2 blowing in from the sea inland and from the industry into the cities.
Vlaardingen West stinkt als de pest. Vlaardingen West stinkt als de pest.
I think to really understand port cities and health, you have to see port cities from the water. Without the water, you can't understand the question of port cities and health. First of all, port cities have been hubs of transportation of goods, of people. Ports allow you to bring in new ideas, they provide trade, they provide new technologies, innovation, creativity, and all of those are elements that allow a port city to grow and to blossom. They spur all the richnesses and the wealth of port cities. On the other hand, lots of diseases either travel via the water or are even waterborne. So diseases like cholera are typical for port cities because they're filled with water. I mean, just remember that many of the big diseases like the plague, they always had entrance points through ports. They are the places from which migration has started. I mean, the whole migration from Europe to the United States went through port cities. And often people would even create entire migration districts on this side of the ocean as well as in the United States, for example. The Venetians in the 14th century introduced quarantine to make sure that any vessels coming from abroad would be stopped in the port for 40 days, which is what quarantine means, to make sure that any disease was captured, seen, addressed before the people came in. So unless we understand how water works and what impact it has on us, it's difficult to even mend the problems. And currently, disciplines, management, institutions, governance, they're all split. So there will be planners working on waterfront redevelopment, like what we see here. And they will be looking at water as a space of leisure, as a space of pleasure, and they will describe water as being blue and nice and wonderful. And just 1 kilometer over, we will have industrial water, which is being planned by a different type of people for different purposes. But the water is the same. So we should go back to having a comprehensive understanding of water as a system that brings together the urban parts, the industrial parts. And I think that's the way how we should plan them, because in order to have a healthy port city, we need to start with the water first as the connector between port, city, territory, and the oceans.
Quarantine Station Hayplant was a facility for sailors with contagious diseases. Although completed in 1934, partly because of the discovery of penicillin, the facility never served its intended purpose. Instead, it became a quarantine hub for Jewish refugees from Eastern Europe preparing for their journey to America. In the spring of 1945, a typhoid epidemic erupted in the nearby town of Spijkenisse. Patients were transported to Quarantine Station Hayplant, where teams from the Red Cross, representing 6 countries, provided care. By the summer of 1945, the last patients were discharged. Afterwards, the buildings were used to accommodate elderly patients of the Delta Psychiatric Hospital. The complex stood empty from 1957.
Hi, Lex.
Hey, welcome on Quarantine Island.
Nice to see you. It's a real pleasure to be here and to
The
finally meet you.
history starts here of public health.
So, Lex, I heard that there are studies about Rotterdam that lots of children have asthma. Is that also related to this port city problem?
Yeah, it's partly related to the port, but it's actually the traffic. There is a motorway going up north. That's one of the most polluted areas in the Netherlands. And you have all these flats where young children live, and if you have asthma, the air pollution will create exacerbation, so you get more asthma episodes. And part of the air pollution is, of course, created by the traffic that comes from the port. The port must become a much greener port. That's the idea.
And the transport flows need to be much greener, because getting circularity into the port itself is one thing, but how do we make sure that ships that come from anywhere in the world are as green as we would like them to be?
Yeah, some of the ships enter the city center. And most of the ships now are really pushed out towards the sea, which in essence is a good measure. But still we have a lot of traffic. But on the other hand, the city is also expanding. So the city is moving towards the port.
Thinking about public health, it's not as easy as saying air pollution is the problem. It's really about understanding all the different factors that together create public health.
There is no single factor that will change public health. It is a combination of all different factors: how you live, where you were grown up, your education, your income, the job that you have, but also the environment in which you live. Rotterdam is one of the cities with the lowest life expectancy, so more health problems than in other areas. But it is partly related to the big city, traffic, noise, air pollution, but also related to the port, because the port creates an enormous amount of traffic.
Yeah, it's kind of a dance. On the one hand, the port wants to be visible through the great cruise ships in the center.
Exactly.
But then they need sea-to-shore electricity, otherwise they're polluting.
Yeah.
And the city needs to respect where do we want to move, how do we interact with the port functions in Maasvlakte 2, for example.
Yeah, exactly. And now we have this enormous challenge to build like 90,000 new houses in Rotterdam in the next 10 years. And where do you build these houses? In the areas where you meet the port.
Well, or...
So that's a conflict.
Exactly.
Yeah.
So what are the public health challenges, say, for example, related to sea level rise? Is that even discussed?
Yeah, because if you have floodings all the time, it will create diseases, infectious diseases, waterborne diseases. So we have this idea that some of the diseases that we got rid of, if we have, the temperature will rise, maybe in 10, 15 years' time, we will get malaria back. Malaria was here 100 years ago, and we got completely rid of it. But if we have floodings all the time, it becomes 3-4 degrees warmer, then we will get malaria back. And I think it will happen where ports, rivers, and people meet each other.
Until the mid-20th century, the various functions of city and port were always closely related. Living, working, recreation, manufacturing, storage, transit, trade, transport. Almost everything took place side by side in a compact area. But ships got bigger and bigger, and so did the volume of their cargo. Over the past 100 years, the port of Rotterdam moved further west towards the North Sea. The new waterway was created in 1870. This canal to the North Sea redefined the maritime destiny of Rotterdam. The project's success would pave the way for larger vessels and increased capacity. As a result, the old port function around the city centre and on the south bank largely disappeared. The freed-up space is now increasingly used for urban functions, living and working. But at the same time, the Rotterdam port is also expanding.
Europoort, de veerwel, de monding van de Youngshaven en naar Brediep.
Industrialization began in 1930 with the construction of Europe's first petroleum harbour. This first major expansion of the port would give the Port of Rotterdam its leading position in Europe. More expansions followed after the Second World War, such as Europort and the Maasvlakte. This made the port one of the largest in the world.
When we look at this landscape, it has been built for and with petroleum, for and with containers. Once the global flows are going to change, in line with the energy transition, many of the spaces will have to be adapted. And often the port itself may not have zoning and can easily transform, but the city or the landscape next to it may have to change in a different way.
The landscape of the Rotterdam port retains all the characteristics of the port of the 20th century. Will that change dramatically? What will happen to the city? Who will take the lead in developing new policies? To answer these questions, the universities of Leiden, Delft and Erasmus University Rotterdam are conducting research led by Carola Hein with Yvonne van Mil and other researchers. The work involves observing the ever-present interplay between city, port, territory and the all-connecting factor, water.
We've done spatial mapping to see over time how oil installations, port installations have transformed in relation to the city, the landscape, in relation to water and land.
Many kinds of factors affect public health in port cities. Negative factors such as air pollution from ships, trucks and factories can be partially compensated if people have access to high-quality food, education, healthcare and at least a basic income. The scientists focus their research on the relationships between these factors. They literally map out these spaces. This provides a coherent picture of the health situation in a port city. This, combined with the most up-to-date data, allows for a better understanding of environmental conditions. Moreover, it also provides insight into who the most important decision-makers are in a particular area.
And in the case of Rotterdam, what we find is that the port of Rotterdam leads. The port is trying to grow, is trying to almost escape from the city, and the city is trying to catch up and embed the port in its development. And that's important also for future developments, because now the port is in the lead. So any changes in the energy form, for example, would have to be led, or are much easier if they are being led by the port itself. That's quite different from other cities, even in Europe. So if you look at Hamburg, for example, Hamburg is a city-state. So the development of port and city always occurred in a tandem, and the port has never been able to grow beyond the borders of the city, or the city-state. In the case of London, there has been a huge port, but this huge port, I would argue, has been pushed out by the city because the urban functions are much stronger than the port functions, so that the new port is actually some 70 kilometers down the Thames River. And so in every city across Europe, across the world, you have changing relationships between port and city and territory.
The port of Rotterdam took full advantage of the enormous expansion of the world economy. But that development also had a darker side. In 1970, air pollution in Vlaardingen reached an alarming peak. This small town is located right beside the petrochemical industry. For years, the population was suffering from health complaints as a direct result of industrial pollution of the air, water and soil. This time, enough was enough.
Dit is mijn school. Het ziet er nog precies zo uit als toen, aan de buitenkant. En ik kan me nog herinneren dat ik hier, bij dat beeld, een interview heb gegeven aan een Duitse journalist. Want er waren cameraploegen uit de hele wereld, omdat onze school was gesloten. En onze school was gesloten omdat er weken ongelooflijk veel vervuiling was. Deze school lag net onder de walm van de ENCK, dat was een kunstmestfabriek. En het was zo erg dat de gymnastieklessen, die vonden daar plaats, die moesten worden stilgelegd. Hier was een noodgebouw. Daar was het niet zo hard, daar was het heel warm. Er was heel veel smokvorming. Er moest gesloten worden. Toen hier kregen ook mensen hoofdpijn. En toen om 12 uur, toen besloot de rector dat kan niet zo langer. En toen heeft hij de school gesloten. Nou, dat is echt dramatisch. Dus toen heb ik het journaal opgebeld. En ik heb gezegd van nou, ja, moet je horen, is een school gesloten, 1100 leerlingen vanwege luchtverontreiniging.
Wie van jullie heeft er nou van de week last gehad van de luchtvervuiling? Jij? Wat heb je dan gemerkt?
Nou, ik heb toen ik een keertje terugkwam van een andere stad, toen had ik er gewoon last van gehad. Toen werd ik misselijk en ik heb overgegeven in die rust.
En toen? Wat heb je toen gedaan?
Nou, toen ben ik naar bed gegaan en hij tegen moeder zegt de moeder, nou, dat komt zeker wel van de luchtvervuiling.
En er waren verschillende klachtengolven, dat het niet te harde was. Dat bruiste onder de leerlingen en we hadden dat actiecomité. En de volgende dag, toen zeiden we als leerlingen van, er moet iets gebeuren, er moet iets doen. We zaten daarboven, in het lokaal, daarboven is het lokaal, en te overleggen wat daar moest gebeuren. En toen zei een van de andere jongens uit de comité, zei, hey, die moet je nou eens kijken. En we keken op school, en we keken hier het schoolplein en de hele school stroomde weg. Honderden leerlingen liepen zomaar het schoolplein af. Vlaardingen West, stinkt als de pest. Vlaardingen West, stinkt als de pest. Nou, ik ken het nog helemaal. Ja. Ja. Ik zei tegen Hugo, mijn vriend van destijds, we moeten er achteraan. Hij op zijn poeg, hij pakte de poeg en zei, waar moeten we heen? Nou, laten we naar een andere school gaan. Toen zijn we naar een andere school gegaan en hebben we gezegd, jij tegen, ENCK moet dicht, stop de luchtverontreiniging. Toen zijn we verder naar het stadhuis gegaan en zijn daar gewoon gaan zitten. En op een gegeven moment toen kwam er iemand het stadhuis uit en die zei van, wij hebben besloten dat er een delegatie wordt toegelaten van leerlingen, van 5 personen. En toen hebben we dus gezegd van nou, de school is dicht, de luchtverontreiniging, we kunnen niet meer les krijgen, die ENCK moet dicht. Het leefde, we wisten dat we in een hele gore, ongezonde omgeving woonden. Maar dat we zelf ook iets konden doen en dat we gehoord werden. En de staatssecretaris heeft die brief onthouden. Een vraag in de Kamer, vraag in de gemeenteraad. Het kan toch niet zo? Kop in de kranten, scholieren pikken het niet langer. En toen is het gebied, vlak binnen een maand of zo, is het Rijnmondgebied tot saneringsgebied uitgeroepen. Maar het drama dat aan voorafgang was natuurlijk wel stevig. Dat wij hier echt ademnood hadden. Dat mensen gezondheidsproblemen hadden. Het water was goor. Er kon niet gebouwd worden omdat de bodem vervuild was. Aan alle kanten leefde je dus een hele smerige streek hier. En dat was natuurlijk niet fijn.
Yeah, so the students were really at the intersection. You were locally active, but you reached the national decision makers.
Kijk, we waren een beetje naïef. Het was in de 60 en de 70 jaren, dus we hadden het ook over seks en we hadden het over democratisering. Maar milieu was in Vlaardingen een extra thema. Dus dat was in een hele opstand van, we willen het anders. Dat gebeurde hier dus via het milieuprobleem. En dat kwam op de lokale agenda, op de Rijnmond-agenda en op de nationale agenda.
As the port expanded west, the urge grew to redesign the city. And as the skyline evolved, so did the city's commitment to addressing health challenges. Recognizing the impact of urban environments on physical and mental well-being, Rotterdam urban planners are increasingly adopting a comprehensive approach to urban design, with public health more than ever as a starting point.
We have, since 2021, a new city vision. Important in that city vision is that we have an integral vision, so not only on building houses, but also looking at the well-being of the people living in our city. And we use 5 perspectives. Compact, so we're not going to build on the outskirts of the city, but densify the existing city. Well, the Rijnhaven development is an example of that. We also say it has to be sustainable. So sustainability is very important. We also say that it has to be inclusive. Everyone should be able to contribute or be part of city life. It has to be healthy. We now have parts of the city where people die 7 or 8 years before or earlier than in other parts of the cities. And we also have productivity, so being a productive city, that means that you have an eye for the education, from the lower education, primary schools, up to practically skilled education towards university, and also jobs.
The most recent developments and innovations in the Rotterdam region aim at making the port and city more sustainable. Oil becomes hydrogen, and hydrogen power plants are being built on the Maasvlakte. Shipping and industry will become cleaner. There is no other choice. The area is densely populated, with the population rising every year.
In many cases you come across health. For instance, if there are no trees, only stones, buildings and paving, it is much hotter on warm days during summer than in other parts where there's more green. And we also see that there's a rise in people dying, especially elderly people. So that is something you have to cope with. So we want more green to be part of development. What we also see is that noise now is a big issue. You can't build everywhere because, well, there can be a lot of noise in the port also, but also closer to busy roads and the highways, for instance. So if you want to build there, you have to come up with smart solutions. In the past, we looked at cars and trams and metro, cyclists, and then the pedestrians, and we flip that pyramid around. So we start with the pedestrians, then the cyclists, the public transport, and the cars. It's healthy for people to walk and to experience green, and that is good for your well-being. So we want people to walk more, for example. And if you look to the river and the Rijnhaven, it used to be private or part of the port. And now we're making them accessible for pedestrians, cyclists, but mainly pedestrians, making them more green so that people can walk around along the river, around the Rijnhaven, for example, and therefore are nudged to walk more because their area where they live is more attractive to walk, and therefore they start walking. So that perspective is also really important. So a walkable city is, you could say, an attractive city, needs a lot of green that makes it attractive, but is also good for the health of the people living in our city.
In recent decades, Rotterdam has been struggling with the effects and threats of climate change. The city centre is only 2 meters above sea level. The city is also vulnerable to extreme rainfall. Its location at the mouth of the delta makes the region especially susceptible to high water levels from the River Rhine.
That is another challenge that we have to cope with. So, for instance, on the Rijnhaven, we are looking at what level should we build Should it be an average level or a more safer level? What do you do inside the buildings? Can those buildings be flooded, the ground floor, and nothing will happen? Or will all the electricity, the internet, and so on will shut down? So together with other parties, we do research on how can we have a sustainable delta, say, 100 years from now.
We're here now in Vlaardingen on the port. The weather is nice. Everything's been solved. Your activities have led to a great success. What you did 50 years ago has now led to clean air, water. Is that correct?
Ja en nee. Het ziet er mooi uit, maar je weet niet wat er in het water zit. Want dat ruik je niet altijd, dat zie je niet altijd. Je weet niet wat in de lucht zit. Het is verbeterd. Toen een Rijnmond saneringsgebied is geworden, toen is het wel verbeterd. De de SO2 is beter geworden. En je ziet niet meer van die geurige en kleurige dampen. Maar nou ja, stikstofprobleem, vast in het water zijn hele actuele problemen. Die zijn er nog volop. Plastic, kleine microplastics. Dus dat zijn dingen die je niet ziet. We zijn er nog niet, maar we hebben wel stappen gemaakt. Zeker in Nederland.
And shall we have a look how clean the air is today? I have the app open so that we can take a look at what it actually looks like.
Aha.
Because you can see along the coast how the ships pollute.
Aha. Oh, yeah.
And even the industry that pollutes. So you can see all these NO2 blowing in from the sea inland and from the industry into the cities. So apparently, even if it's invisible, the pollution is still quite present, in particular in this area.
Our country spends a lot of money on healthcare. And those numbers are enormous if you compare them to city development. Then the city development is only this in terms of investment if you compare it to this in healthcare and related to healthcare investments. So there lies a challenge, but also an opportunity to further design healthcare and city together.
Invisible air pollution caused by nitrogen emissions and particulate matter seriously threaten public health in this area. Do these walkers, joggers and training athletes realize this? Or do they think they can get a nice breath of fresh air along the waterfront and improve their physical fitness, now or in the future?
What kind of key decisions do we have to make to go towards a more circular, a more environmentally friendly port development? And you could ask the big question, Rotterdam smart port? Well, maybe a smart port of the future is a smaller port of the future. So we may have to challenge the driving values, the driving ideas, for example, of growth. And we really need to ask the question, what is the value of having a big port for the city and the territories nearby? And not just only as an economic driver, but also as one that brings healthy living conditions to the areas next to which it is positioned.